it's Dr. Jade. Happy New Year, y'all. We are coming on for a weight loss Q&A and a little story time. As you join, drop in the chat, where are you joining from? Where are you joining from? For those who are new here, I'm Dr. Jade. I am a board-certified family medicine physician, wellness and weight loss specialist, owner of the Inspire Primary Care Medical Practice in Las Vegas, and host of the She Inspires podcast and the She Inspires Wellness Community. As you join, drop in the chat, where are you joining from? And I want to know, what are your top 3 wellness and weight loss goals for the new year? What are your top 3 wellness and weight loss goals for 2024? Drop them below. All right, Glenbury. So sincerely, Gabby says that she's from Glenbury, Maryland. Wow. Okay. Welcome. Okay. Of course, I'm joining live from Inspire Primary Care in Las Vegas. Maryland's in the house. And so we're going to start with a quick story time. And then I'm going to answer some of the questions you guys submitted about wellness and weight loss. As you join, if you have any wellness or weight loss questions, please drop them and I'll answer your questions live as well. So the first story time goes to a big shout out to one of our medical weight loss members here at Inspire Primary Care, who has lost 70 pounds in 12 months by being a part of our medical weight loss program here in Las Vegas at Inspire Primary Care. Some highlights to her weight loss. You guys know I help my patients. My why in primary care is to help my patients transition to a healthier lifestyle and a healthier weight and prevent and reverse chronic diseases by transitioning to a healthier lifestyle and a healthier weight. So this patient and this member of our practice lost 70 pounds in 12 months. And with that, in addition to the weight loss itself, they no longer have sleep apnea. Okay. They were on a BiPAP machine every night to help them breathe. And now they're completely off of that machine. All right. So that's number 1. Sleep apnea has been reversed. Number 2, no more back pain. Previously needed to see a chiropractor every week for adjustments, and now no longer needs those chiropractic appointments because the back pain is gone. Number 3 is no longer has high cholesterol. So when they joined the practice, total cholesterol was over 240. It's now 175, which is normal. Triglycerides were elevated at 184 and are now 124. And LDL, which is one of our unhealthy cholesterol, was 169 and is now normal at 108. So high cholesterol reversed, which decreases our cardiac risk of heart attack and stroke, which is amazing. All right. And number 4 thing that happened is depression. Mood has been improved. And so we were able to safely transition down and off of depression medications by transitioning to a healthier weight. Confidence is improved. And number 5, no longer has prediabetes. So when they joined our medical weight loss program, they had a hemoglobin A1C of 6%, which was in the pre-diabetes range, and is now 5%, which is normal. So shout out to this amazing medical weight loss member who has now been a member of our practice, of our medical weight loss program for exactly 12 months, has lost 70 pounds, and has reversed 5 aspects of chronic disease. This is why I do what I do, okay? So chronic disease prevention and reversal, if you're in the Las Vegas area, I'd love to care for you. I'd love to help you on your wellness and weight loss journey. Now, here's one of the questions that were submitted to me. As you're joining, drop in the chat, where are you joining from? Any wellness and weight loss questions you have, drop those. I'll answer them below. And if you are, I also want to know, what are your top 3 wellness and weight loss goals for 2024? So drop those below. We're going to scan the chat near the end of the live and answer any questions you guys have, okay? And I want to know your wellness and weight loss goals, your top 3 for the year. All right, so Box with the Doc. I'm going to take a moment to just tell you guys, our next community wellness event in Las Vegas is on the 20th. I just put the promotion out and we're already almost halfway full. So we have room for 30 people, 30 people we have room for our free community wellness event coming up at the end of this month, okay? January 20th at 9 a.m., but adults must RSVP. This one is for adults only. It's a free event. Come box with your doc. And I'm super excited about that, y'all. So, and you guys are excited too, because before I even announced it, we were almost halfway full on those RSVPs, which is exciting. So the link is in my bio. Just click it if you want to join an RSVP for Box with the Doc before our slots completely fill up. All right, so the next question that was submitted to me was, is your medical weight loss program for Nevada residents only? I get this question a lot. Yes, I am licensed in the state of Nevada. If you want me to be your doctor or to be your obesity medicine doctor and work with you on medical weight loss or primary care, you do have to be a Nevada resident or at least have a residence in the state of Nevada. I do have some patients who live in multiple states, but they have a residence in Nevada. So you have to establish care with me as a Nevada resident, because I'm licensed in the state of Nevada. However, if you are in a different state, and this is the question I also got, how can I work with you on my wellness and weight loss if I'm not in the state of Nevada? So if you are in a different state or a different country, I see that we have Maryland in the house. Drop in the chat where you're joining from for those others who are joining. So if you're in Maryland or any other state or country, the way to work with me on your wellness and weight loss would be to join the She NSPIRES Wellness Community. All right, that's our private global wellness group for women, busy professional women who are transitioning to their healthiest lifestyle and healthiest weight together in community. I am the host of that community. The same philosophies I use in my practice with my patients one-on-one, we are doing in the community together. I do monthly wellness workshops. We have a goal setting workshop coming up in the community. This is our goal setting month within the community, okay? And we have monthly master classes with other health and wellness experts. We've got an amazing master class on the calendar with one of my OB-GYN friends, Dr. Jade, who will be doing a hormone course, all things hormones in the community this month. And then next month, one of my physician friends, Dr. Marguerite, is going to be teaching about plant-based nutrition, who is a physician who's been a plant-based expert for many years. So in addition to master classes with my other health and wellness expert friends, we also have monthly wellness workshops with me, and we have the community, other like-minded women all transitioning to their healthiest lifestyle, healthiest weight. And when you guys ask, how can you work with me if you're not in Nevada? That is how you work with me. She NSPIRES Wellness Community. It's only $49 a month to be a part of the community, okay? But if you're in the state of Nevada, I can be your doctor. I can be your primary care or medical weight loss physician, and you just go to inspireprimarycare.com. No I in front of Inspire, and that's how you join our medical practice. We are now enrolling new primary care and medical weight loss members at inspireprimarycare.com. No I in front of Inspire. As y'all are joining, drop in the chat, where are you joining from? Okay, I see some of my Nevada friends here. Sabrina Elise, hey sis, definitely from Nevada. SG Ping, hey sis, from Nevada, in Las Vegas. So I see Las Vegas in the house, Maryland in the house. Drop in the chat, where are you joining from? And let me know, what are your top 3 wellness and weight loss goals for 2024? I'm scanning the chat to answer your questions. I'm going to answer a couple other questions that were submitted to me. We're talking about weight loss Q&A today. And I gave a little story time on one of our members of our medical weight loss practice who has lost 70 pounds in 12 months, and we wanted to celebrate that. Okay, so looking at the chat, so Sincerely Gabby has dropped her goals, and so she says, drop 20 pounds in 6 months. Okay, amazing. And then number 2 is progress our PT for kneecap dislocation. Okay, so you want progress on your physical therapy for your knee. And let's see, those are the 2 things. I didn't see a number 3. So the thing I want to ask you, Sincerely Gabby, you said drop 20 pounds in 6 months. Do you have a specific strategy and structure? So in our goal setting course that's coming up in the She NSPIRES Wellness Community, we will be going over the actual specific and effective framework to making wellness goals, so that they become a reality. All right. And so if you do not have a specific strategy and structure on how you're going to transition to that 20 pounds in 6 months, join the She NSPIRES Wellness Community, because we will have that strategy and structure for you there. We also have a course on my trademarked method, the Inspired Health Method, within the community. So you'll want to check that out as well. I also have a course called Transitioning to Your Healthy Weight Range, which tells you my specific method that has worked to help my patients transition to their healthy weight range effectively and successfully. So those are all courses that are recorded and in the She NSPIRES Wellness Community. That's our own private app. and it can be accessed from desktop, and under the courses section you will find those. So all of those could really be really helpful in your goal of dropping 20 pounds in 6 months. If you all have other health and wellness goals, drop those in the chat, or weight loss goals for 2024, drop those in the chat. I want to know what you guys are working on. Let me share my top 3, okay? So my top 3 wellness goals, as I was coming on, I was thinking about this too. So my top 3 wellness goals for 2024, y'all are helping to keep me accountable too, okay? My number 1 is to maintain my healthy weight range. So 2023 for me was a big health and weight transformation for me. I've been very transparent that I gained over 60 pounds with my my 2 pregnancies that I had, and I was trying to transition back to my healthy weight range. So 2023 was a big year of transitioning back to my healthy weight range, both by using my Inspired Health method, which I share how to do that in the She Inspires Wellness Community, and by joining for a short period of time my medical weight loss program here at Inspire Primary Care. Okay, so now my goal is to maintain my healthy weight range now that I've transitioned to my healthy weight range, and to really prioritize strength training this year, because I really want to get toned and ripped up a little bit, okay? Which is why y'all want to join me at Box with the Doc, okay? Link is in the bio to join our next community wellness event. My number 2 goal for 2024 is to continue to eat a nutrition that's primarily plant-based. That's always my goal. Whole food, plant-based nutrition primarily. 80% of my nutrition is my goal. But I really want to emphasize increasing more of protein in that, because I don't get typically enough protein. So that's a goal. And then number 3 is keeping my morning routine. I share this often. My morning routine is prayer and Peloton, and that really pours into me spiritually and physically before I start pouring out to others. And so I want to keep that morning prayer and Peloton routine Monday through Friday. So those are my top 3 wellness goals for 2024, and I want to know y'all's. Okay, so SG Pink says, hi, for 2024. She wants to drop this last 60 pounds and figure out a strategy to make that happen. So this is my sister, SG Ping. So definitely recommend joining the She Inspires Wellness Community, because that's what we're doing together there. The strategy and structure is there. You said you want to figure out a strategy to help make that happen. My Inspired Health method, trademarked method, is there for you for that. The course in the She Inspires Wellness Community is there. The Healthy Weight Range course is there. We have our goal setting course coming up. All that you need is in the She Inspires Wellness Community. The link is in the bio, or DM me the word wellness, and you'll have the information to join the She Inspires Wellness Community. And you'll have a whole community of like-minded women all transitioning to our healthiest lifestyle, healthiest weight together. So definitely recommend checking that out so we can help you get to that strategy and structure to lose that last 60 pounds as you so desire in a healthy and effective way. Scroll in the chat to see if anyone else has, drop in the chat, where are you joining from? If you have any wellness or weight loss questions, I'm going to answer a couple more that were submitted to me before, and then I'll scan the chat again one last time and see if any other questions have been submitted. If you have any wellness or weight loss goals for 2024 you want to share, drop those too. All right, so one of the questions that was submitted to me prior was breastfeeding. If I'm breastfeeding, can I join the medical weight loss program? So breastfeeding is one of those things where let's have a meet and greet about that, because it is patient-physician decision-making, and depending on which medication we want to use, the recommendations will be different. So if you are the person who submitted that question, just click the link in bio and schedule a meet and greet with me. Those are free meet and greets, and I can get your specific questions answered and let you know if that would be recommended. The general answer, especially since most people are inquiring about the GLP-1 agonist, which is going to be Mounjaro, Zepbound, Ozempic, Wegovy, those medications do not have a specific recommendation, meaning it is patient-physician decision-making, because it's unethical to do studies on women who are pregnant or lactating. Of course, pregnancy, you do not use these medications, but lactating is kind of that gray area where it's shared decision-making, because lactating women were not included in the studies. So it's just something important to know. If you are in the Las Vegas area, schedule a meet and greet with me. And if you're in a different area, talk to your doctor and have that individual conversation if you are breastfeeding. All right, and then I had the last question that was submitted to me before was, with your medical weight loss program, is this including the shot. And so a lot of people talk about the shot. Again, that's going to be Zepbound, Mounjaro, Ozempic, or Wegovy. Yes, that's not the only medications options that my medical weight loss program can include. These are all tailored to the individual. Everything I do is tailored to the individual. Nothing is one size fit all. However, the most common medication and the most effective medication classes that I do send and include in the medical weight loss program are going to be those GLP-1 agonists, once weekly injectables. So yes, that is what it is. People ask about the pricing. We're very transparent on that. If you are a primary care member only, that is $149 per month at our practice. And if you are a medical weight loss member, primary care is included with that. It's a $50 upgrade, so that's $199 per month plus the cost of your weight loss medications. So let me know if you have any questions about that. We are now enrolling new primary care and medical weight loss members at inspireprimarycare.com. No I in front of Inspire for Nevada residents. And if you're not in the state of Nevada, but you're looking to work with me on your wellness and weight loss, join the She NSPIRES Wellness Community, okay? DM me the word wellness if you're on Instagram, and we'll get you the information, or click the link in bio, and the information is there to join the She NSPIRES Wellness Community, and it's only $49 a month right now, okay? And you're grandfathered at that rate if you join right now, and that one is any state, any country, to join our Global Women's Wellness Group. What other questions do you have about wellness and weight loss? Drop them below. I'll come back and do other lives on your questions. Thank you guys so much who submitted questions. Thank you to those who dropped your wellness and weight loss goals for the year in the chat. And I'll see you next time. Have a great day.